All right, guys, can we talk about testosterone replacement therapy, please? I'm seeing it all over the place, and it's really concerning because I feel like people are starting to look at it as an alternate and a crutch to actually eating right and exercising. Okay, um, I turned 40. All of a sudden, I'm tired all the time. I'm not feeling like I'm making progress in the gym. So it must be just by default that I need my testosterone's low. I haven't been checked, but everybody on these forums that I'm on says go get TRT. It'll fix everything. It's great. Okay, even though nobody's looked at how are you eating. What is the routine you're doing? Have you been doing the same routine for the past 2 years, right? Is it time to maybe switch it up and do something different? There's a lot of things that you can look at about breaking a plateau if you're looking at fat loss, breaking a plateau if you're trying to gain weight and you can't gain weight anymore. There's a lot of things as far as energy that can be looked at that have absolutely nothing to do with testosterone, okay? Not to mention that how you eat and the things that you're doing can help boost and increase the testosterone you have naturally without having to take medications or supplements to make it happen, okay? I had normal testosterone, but on the low end before I started carnivore. I was in the 350, 375 range, okay? Within 6 months, I was up to 700 in testosterone, okay? Just by eliminating carbs and adding in meat, doing the same workouts that I've been doing. I've been doing CrossFit for several years, all right? It was absolutely incredible. No TRT needed, and that's really the only thing that I did. I changed my diet. Now, I've seen people who have had increases in testosterone through their diet, changing their exercise, getting more sleep, doing stress reduction exercises. There's a lot of different things that you can do. Don't default. I'm really tired of society today wanting to default to a pill, to a medication, to the doctor giving me something that's prescription that I can go pop in my mouth and everything will be fine. I don't have to change anything because that's too hard. And I like my carbs, even though I don't need them, and all these different things that people want to subscribe to because it's easier. It's easier because it's not as good for you. The quality of what you're doing to your body and your health is going to be more challenging if you're doing it right. If you're just taking the easy way out, then yeah, sure, you're going to see some immediate benefits, and then 6 months, a year, 10 years down the road, you're going to be sick, ill, weak, and whatever else. It just doesn't make sense to me, guys. Build healthy habits, change your metabolism because your metabolism is your health, right? Improve your metabolism, improve your health, right? Get fat adapted because that's going to help your hormones. That's going to help your bodily function and burning fuel, right? It helps everything. And if you don't see anything from that, then go look at some medical options. But get the baseline done first, guys. You have a foundation of performance that your body needs to work off of before you identify, hey, I have a problem I need to go fix with medicine, okay? Get it right. Eat meat, eat fat, cut out the carbs, stop BSing with medications that you may not even need because they're not doing anything for your lifestyle.